Hello everyone, thanks for listening, and this one is going to be about why Medicare for All is a scam, morally, ethically. I don't have enough information. I mean, economically, it's a scam as well, but it's mostly tied to its ethical components. Because theoretically, this is their claim, right? Universal health care is cheaper. Because they can offer services to people for less and so on and so forth, which, of course, anybody who's a student of Bastiat or anarchist in general who understands economics, that they're ignoring the unseen, which is the rise in commodity prices.
1989.
Sorry about that. Is the rise in commodity prices due to taxation and the cost that the so-called universal healthcare programs put on the rest of the economy, because capital is being diverted from whatever those private individuals and groups wanted it to go to, and sent off to the state for their government healthcare. But I mean, I'll give them this, though. This is not a concession towards their belief whatsoever. Their belief is completely immoral and insane. But, theoretically, if everyone in the country who, and let's say it's 100 million people or something, 50 million, 100 million, 120 million, let's say all the voters or all the taxpayers, it's even less than that, I guess. But, theoretically, what they say makes sense. If you forced everyone to pay into one company, then you could take a little bit less from everyone else. Or if by chance everybody happened to pay one company, they could afford to lower their prices if they're making profits over time and so on and so forth, because the volume of their customers is so great. So it's theoretically true that if everyone was forced to pay the government, they could charge you a little less per person. But, you can't let these mathematics get in the way of the ethics of the issue. And of course, an advocate for Medicare for All would say, you're the unethical one for not wanting to pay to help sick people or to whatever, subsidize other people's health care. And on top of it, they'll say you're stupid because it's less expensive if we would just monopolize the market, which is what they want to do. They not right at first. They'll still have, I'm sure, private firms involved in the industry doing this, that, and the other. But, I mean, a couple people have outright told me, get rid of insurance companies. So that literally means that you would only have one option for so-called insurance, and that would be the government. So they're clearly, they're monopolists. And no matter how much I bring this to light to them, they just kind of gloss over it. They never acknowledge the fact that they support monopoly. They never acknowledge the fact that that is the underlying basis of their entire view when it comes to Medicare, is that they're basically saying if we forced everyone to pay the government, it would be cheaper for everyone. And I don't have the numbers in front of me. I can't calculate all those numbers. Who knows how the market will go. But theoretically, that's correct, right? If you took money from everyone, you could take a little bit less from everyone to hit your quota. That makes mathematical sense. But like I was saying, is the ethical implications of that is you are forcing everyone to pay one so-called insurance company. If a private company did that, these same people would be in a huge uproar about it. That's tyranny. That's monopoly. That's this and that and the other thing. But when they advocate for monopoly, they think it's okay because they have this blind faith in this institution or this entity that they call government. And it's foolish because they have blind faith in something that they are admitting is immoral. They can't put two and two together with the ethical implications of literally using the threat of violence to expropriate and cage people if they don't pay into the so-called government insurance program or Medicare. And that's why that is the crux of the argument. The argument isn't about whether it'd be cheaper. That's what they want to make it about. Sure, if you force everyone to pay government, you might be able to demand less from everyone else. And you might be able to cover people better. And you might be able to do this and everything. But that's not the point. The point is that you are forcing everyone to fund a monopolist program. So when the market is destroyed, if they do get their way, and eventually the government is the only option anyone has for healthcare, You have created the monopolistic system that you rail against in so many dystopian films, right? Like, you're the one setting it up to where there's only going to be one group to go for healthcare. You might not view it that way, but if you keep going down the path of the logic that they present for this Medicare for all and this universal healthcare, then that's the point. That's like, why would you need to have, like the one guy told me, get rid of the insurance companies? Well, right. Well, why would you think that you need insurance companies if you think all of this should be handled by one group, the state? It would make no sense to allow the so-called market to exist anymore. If you think, and here's another thing, is that they never think to apply this. I mean, they do, but they don't realize. They never think to apply this to any other aspect of the market at this point, it seems like. Like, think of anything else that you think is somewhat, needed in today's world, like cell phones or something. Like, I mean, I don't think a cell phone is a need, obviously. It's a very nice luxury, which is becoming less and less of a luxury. I mean, I would say it's not even a luxury anymore. It is pretty easy to get a cell phone, even if you're underemployed or even if you're unemployed. And I don't mean even government programs. I mean, if you don't have a job, it's not that much to get $50 a month, get an initial payment for the phone, $50 a month. That's not a lot of money to make. If you can't make $50 a month, then you should seek a charity because you're most likely disabled or something like that. I mean, you could literally scavenge and probably come up with 50, and without even trespassing, and probably come up with $50 a month. But anyway, they don't apply this to any other part of the market. Like, in what other parts of the market do you think it would be okay to force everyone to pay one company? Because you say that would make that service or commodity cheaper for everyone. Because if everybody was forced to pay T-Mobile, then T-Mobile could take a little bit less from everyone, and then they could sell their cell phones for less, however you want to look at that. Of course, at that point, if you're forcing everyone to pay T-Mobile, of course, you would probably then demand that T-Mobile is the only cell phone provider. Or would you allow other markets to exist, They probably don't think of it that way because they don't view cell phones as being a necessity, even though they like to say that sometimes. But that's something that it's not life or death. To them, healthcare is life or death, and that's true. Healthcare is a really important service, and has a lot of important industries tied to it that society, I would say, quote, needs to function smoothly. But that doesn't mean that we should monopolize it in the hands of the government, which is basically their, it's the same thing as a minarchist or a so-called limited government libertarian or whatever, who says basically that government is bad and inefficient, so it should really only do the important things like protect us and administer justice. Well, why would you think you would get any different results in those areas? Like, if a Democrat can find anything that he thinks government shouldn't do, which I don't think is possible, because it seems like Democrats and so-called leftists want government to just control everything. But if you could think anything that government shouldn't be allowed to do, or so, why wouldn't you apply that same logic to whatever else? Like, by their logic, since it's cheaper, like food. Food is a great example of that because, right, a lot of people think that they have that method of thought when it comes to the so-called welfare system and things that government should be providing food and the ability to care for yourself if you can't, which I am not opposed to the sentiment of that. I am opposed to the method of government, which is violence. My advocacy in that falls on charity, and you get off your ass and go do that instead of basically your whole perspective is the government should force everybody else to do it, and including you and me, or however you'd want to put it. They would say the government should force me to do it too, but it's like you already want to do it, so why would you even view it that way? But excuse me. But why not food production? You could almost make the argument that food is more important. Well, I don't know about more important, but equally as important as healthcare, right? Because a good balanced diet maintains your health. So, what you put inside your body as food and fuel is very important. So why can't you make the argument, and I'm not saying that I am, but I'm just trying to do this to expose the insane logic here. But why don't you make the argument that government should be the only source of food? Why should you not get rid of the capitalist food companies? Since your argument is that the capitalist healthcare insurance companies are greedy and that's why everything's so expensive, which is completely false. But if you think that a service is so valuable that it should be monopolized by the government and everyone should be forced to fund and therefore subsidize everyone else's healthcare basically through the so-called government, quote, insurance, the key point being that it's involuntary. It's like an insurance company that forces you to buy from it, right? That's all they're advocating, basically. And so why not apply that to food as well? And then so government would be the main provider of food. I think even Democrats would find that to be insane, but I'm not so sure, especially not communists. Communists advocate that most of the time without even realizing it, and especially a lot of so-called socialists and even anarcho-communists who just have a different word for that, the committee, the society, the collective. It's all just going to boil down into one group controlling all the resources, since your entire view is to monopolize whatever industry it is, right? A socialist has this idea about the workers who work at the factory controlling and all this and that. That's fine if that's what we're really talking about, but that's not usually what a socialist, especially not a Marxist, is advocating. He might think that's what he's advocating, but other implications of his belief contradict that and would lead to what we have seen the Marxist countries lead to. And of course, everybody say that's not real Marxism and yada, 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 yada. And it can't be real Marxism. There was still capitalism in the world. Whatever. They tried to follow the state platform that was laid out by communists, and look at what happens, because it's an insane idea, just as universal health care is insane, just as Medicare for all is insane, and just as having government being the main provider of food is insane. Why not have government force everyone, which they already kind of do this through the welfare in a detached kind of way, but why not have government force everyone to pay them to grow food for everyone, and then just kind of divvy it out in a similar manner that they think healthcare is going to operate? Why wouldn't they do that? Why shouldn't, if the government should have the largest, quote, market share of healthcare, why shouldn't they have the largest, quote, market share of food production and distribution? Or why not, any other commodity that you think is important? I just pick food because it's kind of almost, in a sense, tied to healthcare in that way. It's another commodity or service that is incredibly important. That's obviously incredibly important, right? Food or water, which they already kind of believe that government should monopolize water. Or not monopolize it, but, some people do, especially in the wake of the whole Flint thing and what's going on in Michigan, which is mind-blowing because it's largely the government's fault why that happened. And then they're blaming Nestle for profiting off of it. But it's just, that's supply and demand, right? Sure, I would think it would be noble. Like, Nestle doesn't have to necessarily charge more. Well, actually, technically they do in that specific area, because what a rise in price does when things become scarce is it reflects that, so that the commodity is not consumed without care, right? So, because if they just kept it dirt cheap, there would be no more gasoline at those shops. There would be no more oil because everyone would buy it up dirt cheap. So it trickles out that way, and slowly the price rises to kind of reflect the levels that are there. So it's not really gouging, but, what do you think is going to happen if, say, the government monopolized healthcare or food and then there was a crisis? Like, not only are you... so you're saying you're against so-called price gouging, but what do you think is going to happen when you have created the situation where there's only one group at all that handles most of this? So let's say government has a huge market share of government of insurance and stuff like that, and then there's some kind of banking crisis again or something like that, where services go up, the value of the dollar goes down, however you want to look at that, whatever might happen. You have created a situation where you have one agency to go to for healthcare. Or what if an epidemic strikes? Ooh, that's an interesting thought right there I just had, is what if an epidemic strikes? What if the state creates an epidemic after it has largely monopolized the healthcare market? Now, I'm not saying that that's anybody's particular plan or that that's happening, but it's a possibility, and you can get rid of the fact that government might even do that, even though there's evidence that they've released bugs in California and other parts of the country to track how they travel without telling anybody until it was disclosed in the Freedom of Information Act and stuff like that. But even besides that, what if a natural pandemic or epidemic breaks out, a natural virus starts spreading without any so-called Illuminati doing so on purpose? But you only have one agency that handles most of your healthcare now because you called for it, and the greedy politicians and corporatists are more than happy to oblige you in that insane demand because they're the ones who are going to benefit from the monopoly position that you're creating for them. So what's going to happen then? You think you're against price gouging now when we have competition. Just wait until you create the situation where there's one agency, or mainly one agency, that controls most of the health industry, and then there's an epidemic and everybody has to go to the same agency to get their health care. And there's no disbursement of capital, goods, or services throughout various agencies within the marketplace. And somebody posted that, America's bureaucratic healthcare system is inferior compared to Canada's. Do you not know what these words mean? Like, could you imagine the bureaucracy that will be created by a universal healthcare program? Do they not think that government healthcare in Europe and stuff is bureaucratic? It's the definition of bureaucratic. Literally. You could say that there's a bureaucracy in a private company too, but most of the time when people say bureaucracy, they're talking about the government, because they're talking about all this red tape. Or like if you watch Brazil, the film Brazil, was a really good idea of bureaucracy. But even that, it was intertwined with the state. Those firms were essentially the state. They weren't legitimate private institutions, They were basically a monopoly created by the state, and then they had all of this bureaucratic nonsense, like you need to file 1 million forms to get your air conditioner fixed. That's not how it works, right? If you need your air conditioner fixed, you call an HVAC guy, and a guy comes out and fixes your air conditioning. You don't need much paperwork besides the bill, The fact that it's been proven between the two parties that work has been done and paid for, you don't need all of that. Where the bureaucracy comes from the state, all of their so-called official papers and this and that and the other thing, which, sure, I understand and agree with the idea of need proof that transactions have taken place and stuff, but you don't need government for that. And how much of a bureaucracy do you think you're going to create when, you think you're making it simple because you're creating one agency that everyone's forced to pay, but you're not seeming to realize that even though you're extolling this as the virtue of the system, you're not seeming to realizing that it's going to be 300 million customers for one company. If, so-called, quote, best case scenario for you guys, if it's literally universal healthcare, that means it offers healthcare to everybody in the so-called country, unless you want to stop it short at citizens, which I'm sure you would. Otherwise, it would literally go broke within a matter of days, I'm sure, because everybody and their mother who's sick would be rushing into the so-called free hospital. But it doesn't work that way even in Europe. Well, in some places it does, but that's why you're paying for, $15 cheeseburgers and so on and so forth, because they have to make those costs up somewhere. People aren't just going to work for free. Doctors aren't just going to work for free. The nurses are going to just work for free. The people who make the medicine for the hospitals are not going to just work for free. So those costs have to be made up somewhere. And you're telling me that a government healthcare system is going to put an end to bureaucracy or stifle bureaucracy. All you're doing is creating one huge bureaucracy that's going to be ridiculously inefficient. How many people are you going to need to handle the healthcare needs and wants, even just, of 300 million people? For one company is going to handle 300 million people. And, I call it a company. It's really not, but I'm just trying to keep it in easy examples. Because more or less, that's just what they believe in, is an insurance company that should be able to force everyone to pay for it. And they just call it government. And they don't recognize it's basically the same thing as if they said State Farm should just tell everyone that they have to buy from State Farm because it would be cheaper for everyone in the end. They don't realize that, but that's what they advocate. And that's why it's ethically repugnant, because you support violence and monopoly. You support using the threat of violence to force people to pay your so-called insurance company. And obviously, as a matter of logic and just how government works, you support expropriation if they don't. So if they don't pay taxes, you're going to come take their house and car, and so on and so forth, because you have to make up those costs somewhere. If you're doling out healthcare to 300 million people and someone doesn't pay their so-called fair share, then you're going to have to go collect it, or you have suffered a loss. And thankfully, what I think is going to happen is it's going to be too inefficient, and they're never going to be able to collect that. The problem after that is people need to recognize that taxation is illegitimate and that the Federal Reserve and the fiat money system are illegitimate. Otherwise, the government's just going to keep inflating the currency and keep telling you that you have to pay more taxes because, to cover the expenses. And then, but next thing you know, we've got hyperinflation, and you're burning your dollar or using it for toilet paper, which honestly is really kind of what you should be doing now. But since everybody believes in the dollar still, and the state still calls it legal tender, and people still believe in law, that's not going to really work right now. It would have to collapse, and then people would have to wake up. Because I don't think that they're just going to be like, well, yeah, sure, we're just going to start pissing our dollars away because they're not worth anything. But anyway, so Medicare for all, completely immoral, insane nonsense. And if you think it's not, then why don't you think government should be the main provider of food in the country? And it's out there, or cars, or whatever else you think is even close to being a necessity. Why? What other realm of society do you think government should violently monopolize is the question. And if you don't think that it should be any, then it should not be healthcare either, because it's all the same logic. All you're doing is you're saying that you believe that one company should force everyone to pay it because it would be cheaper that way. And you're missing the ethical implications. Okay? You basically support murder if a guy doesn't pay to help his neighbor get health care. But you need to think about your own self and what are you doing to help your neighbor, as opposed to just calling for a politician to use violence to force your other neighbor to pay for him.